Please sit.
Hello and good afternoon, everyone. I, Dr. Prerna, on behalf of Voice of Healthcare, welcome you all. Today, we are diving into an important topic that many people may not know about, that is, Guillain-Barré Syndrome, or GBS. This condition can affect anyone, and it's crucial for all of us to be aware of its symptoms, diagnosis, and treatment. GBS is a rare but serious neurological disorder that can lead to weakness, paralysis, and in some cases, life threatening complications. To help us understand this condition better, we have with us a distinguished expert, Dr. Rajesh Deshpande, Director of Neurology Department at Jupiter Hospital, Pune. Welcome, Dr. Deshpande. It's an honor to have you with us for this discussion. We look forward to your valuable insights on Guillain-Barré syndrome, its impact, and how we can improve awareness and care for those affected. So, let's begin with our discussion. Sir, could you explain to our audience that what exactly Guillain-Barré syndrome or GBS is in simple terms?
Good afternoon, Dr. Prerna. Thank you for involving me in this very important social activity. Guillain-Barré syndrome, or if it is correctly to be pronounced in the French terms, it is called Guillain-Barré rather than Guillain. So Guillain-Barré are both names of scientists. Guillain-Barré syndrome was described by these scientists and two others, Landry and Stroll, quite a long time ago. This syndrome is a name given to the damage of nerve fibers secondary to viral or bacterial infection. So, in the simplest terms, whenever a virus or bacteria infects our body, our immune system produces proteins or antibodies against that virus or bacteria. These antibodies are supposed to kill only the virus and bacteria. These antibodies peak in the blood after 1 or 3 weeks after the infection. Sometimes these antibodies make a wrong decision. They are faulty and they attack our own nervous system. And this is called autoimmune disorder. Autoimmune because it is our own antibodies which are damaging our own nerve tissue or brain tissue or spine or nerve tissue. So GBS is an illness caused by autoantibodies against certain bacteria and viruses. These autoantibodies, they severely damage the nerve fibers and cause weakness or paralysis in both hands and both legs. Sometimes it also involves respiratory muscles and the bulbar or swallowing muscles and eye muscles. In simple terms, GBS is autoimmune disease of the peripheral nervous system.
That was really insightful, sir. So, as we are seeing that Maharashtra is facing a sudden outbreak of Guillain-Barré syndrome with 127 suspected cases and 2 deaths as of now, mostly linked to contaminated water. So, what exactly is causing this outbreak, and how does contaminated water contribute to Guillain-Barré syndrome?
Actually, although the number 127 is correct, there are no confirmation reports as yet of the actual source of this contamination. Whether it was the water or not, we do not yet know confirmed. The agencies have not confirmed that. The government has not yet confirmed that. However, GBS or the most common reason why GBS like illnesses are caused is a bacterium called Campylobacter jejuni. But it is not the only bacterium, it is not the only microorganism that can cause GBS. There are other viruses, there are other bacteria that can lead to GBS or GBS like syndromes or variants. Now, in this case, in my personal opinion, and this does not apply in every case, but in this case, the outbreak in Pune, if it was water contamination, it would have affected far more number of people than only 127, given the population and given the water consumption. So, in my opinion, this looks like a food contamination rather than water contamination. It is also true that not all people who are infected with Campylobacter like disease are going to develop GBS in future. Only few will have that kind of autoimmune response. Nevertheless, given the density of population we have, water consumption is common to multiple households in a particular area. So if a water source is contaminated, far more numbers would be affected, in my opinion. So this looks like food-borne rather than water-borne contamination or infection.
Okay. And so if someone starts feeling weak or notices other symptoms of GBS, what should they do? How can they get help as soon as possible?
So the first, before I answer that question, I'd like to mention there is a certain timeline which happens in patients of GBS that one should understand. That GBS is not directly caused by the bacterium or the virus or the microorganism. First, the microorganism will infect the human being and will cause either respiratory or gastrointestinal disease. So cough, cold, fever are respiratory symptoms, and vomitings, loose motion, stomach upset. These are the gastrointestinal symptoms. After these symptoms develop and the fever goes away, after the patient improves from these symptoms, after a week or so, patients develop GBS like illness where they may feel tingling or numbness or abnormal sensation in the distal, in the lower part of the hands and feet. And then they go on to develop weakness. Weakness develops usually in the legs first. So it develops in the feet as well as in the thighs. And the patient may have difficulty in walking or slight imbalance as the first symptom. The weakness gradually progresses over a period of a day or a week. The weakness gradually progresses and involves hands. So the patient will become weak in both hands and legs over a period of more than 24 hours. Now, it is very important to understand that GBS may develop over a period of hours also, but it is never sudden like stroke. It doesn't develop within a few seconds. Also, it doesn't develop for more than 2 weeks. So GBS develops over a period of 2 weeks gradually in most patients, where the weakness starts in the legs and hands, then it progresses so that the patient cannot walk. In some of these patients, about 30% of cases, there is involvement of the respiratory muscles also. Those patients will develop breathing problems, or they will go out of breath, and they will have hoarseness of voice. They will be unable to breathe, maintain the saturation. These are the patients who will need ICU admission and also ventilation. There is still a lesser number of patients, about 10% of patients, who will develop weakness of the swallowing muscles or even weakness of the eye muscles. Those also will need the necessary treatment for that. So what the patient should look for is weakness in the hands and legs that is increasing gradually over a period of 2-3 days. Rarely it can also increase in one single day.
Okay. So is there any cases like a person with comorbidities, they are also facing like heart problems, diabetes, they are basically impact of these this GBS is more seen in these kind of patients, like patients having
Yes. So
diabetes and
yes. Other than the regular symptoms, as we described earlier, that the weakness of the hands, legs, and respiratory muscles, most of the GBS patients, about 50 to 70% of the GBS patients, also develop sudden fluctuations in blood pressure, either very low blood pressure or very high blood pressure. They also develop tachy or bradyarrhythmias or tachy or bradycardias, meaning that the heart rate will become suddenly very high, above 120, or very low, below 50. So patients who already have diabetes or blood pressure, who are smokers, alcoholics, those who have immunocompromised state like HIV infections or AIDS, or those who are on anti-cancer, anti-malignancy medicines, those who have some muscle disease, these patients may be more likely to suffer a lot more or may have fatal complications of GBS related changes in blood pressure and heart rate. And that's why patients with comorbidities will always have more risk of fatality in GBS.
okay. So and once GBS is diagnosed, what treatments are available? How do doctors help patients recover from GBS?
So when GBS is diagnosed, one thing is very necessary to understand that as soon as the diagnosis is made, it is better in current scenario in Pune, it is better to observe the patient in hospital, and if the to observe whether the deficit is progressing. If it is more than 2 weeks after the onset of weakness, very unlikely that it will progress any further. And if at the end of 2 weeks the deficit is not much and the patient is able to walk and doesn't have any breathing issues, they can stay at home. However, if the breathing problem increases and the patient needs to be in the hospital, the first thing is that the doctor should ensure that their vital parameters, their blood pressure, pulse rate, heart rate, and respiration, oxygen saturation are maintained well. There are other parameters because the patients are not able to eat. There are other parameters like blood sodium and potassium levels, sugars are to be monitored regularly. Infections should be prevented at all costs. Now, once these vital parameters are stabilized, there are two or three treatment options for GBS. One is called IVIG, intravenous immune globulin. This is a syrup. This is a serum that dose is given over a period of 5 days, divided. And most of the GBS patients will respond very well to such IVIG treatment. The other option to IVIG is a dialysis-like procedure where we take off the blood out of the body from a vein, and then you circulate it through a dialysis machine and filter it so that the antibodies that are causing GBS are removed. And this is called plasmapheresis. These two are excellent treatment options available for GBS patients.
So as we are seeing, like GBS patients, they take time to recover. So, what does the rehabilitation process typically involve, and what challenges do patient face during recovery?
So the initial 2 or 3 weeks, the 2 weeks especially, the patients will progress. After that, about 2 weeks or 3 weeks, the patients will stabilize or they will plateau at a symptom level. And after that, they gradually start improving. Most patients improve over a period of 6 weeks gradually, even if you don't do anything. But it is best to start physiotherapy as early as possible after the patient's vital parameters have stabilized. So once the patient starts stabilizing, physiotherapy should be started, breathing exercises should be started, and this rehabilitation strategy should continue till the patient achieves maximum recovery. Some patients achieve maximum recovery by the end of 6 months. We have also had patients who have recovered up to 18 months. So the recovery may be prolonged, and during this period, once the IVIG plasmapheresis treatment is over and vitals are stabilized, the mainstay of treatment in GBS still remains extensive physiotherapy, and a good physiotherapy, neurophysiotherapy, is essential for the patients to recover well.
Okay. So, are there different types or variants of Guillain-Barré syndrome, and how they
Yeah.
differ in terms of symptoms and severity, if there are any variants available?
So there are many variants, or there are many different ways in which GBS can manifest. We have sensory nerves, we have motor nerves, and both these nerves have two components. One is the tube, the nerve tube itself, and there is a coating around it called myelin. So some forms of GBS will only damage the myelin, which is called a demyelinating type of neuropathy. Some forms of GBS will affect the central tube of the nerve fiber, which is called the axon. So those are called axonal forms of GBS. Some GBS variants will affect only the motor nerve. Some will affect motor and sensory nerve. Some will affect only the sensory nerve. And there are rare forms where only the autonomic system, which controls the heart rate, blood pressure, respiratory rate, those systems are only affected. There is a rare form of GBS that also affects only the balancing and the eye movements, which is called Miller-Fisher syndrome. So these are different variants, and they differ in their symptomatology, whether it is, partial weakness or complete weakness, or weakness plus sensory affection, or weakness plus incoordination, or ataxia, as we call it. Some patients may have only the palsy or paralysis of the swallowing muscles, which is called the bulbar variant. So all these are the variants of GBS we commonly see. However, these variants are quite rare.
Okay. Do most patients from GBS, they do fully recover, or there are long-term complications available? Like, how
So
does GBS impact a patient's quality of life?
So some patients, about 40 to 60% patients recover almost completely if treated in time and if they don't develop respiratory paralysis. Those who develop respiratory paralysis, or those who develop axonal GBS, meaning that the nerve fiber itself is damaged, then they have a poor prognosis, meaning they may retain weakness either lifelong or for a long period of time. About 30% patients will have lifelong, weakness of the fingers. The dexterity of fingers may be affected, or the small muscle movements may be affected in the hands and feet, and there will be food drop. There will be a neuropathy like presentation in such cases. Although those who recover, younger patients who recover well and don't have a prolonged hospital stay or don't have axonal neuropathy, they have a good prognosis. Patients with comorbidities have a poorer prognosis in this matter, especially diabetes, because diabetes and alcohol can both affect nerve fibers and they may impact the recovery over a long period of time.
Okay. And so, do this GBS also affect children's?
Yes, so there is a juvenile or children's variant of GBS which has a slightly better prognosis, but all the rules that generally apply to adult GBS apply to the pediatric. So whatever discussion we had about adult GBS applies to the pediatric GBS also.
Ach- Okay, and so now that we understand what GBS is and how it's treated, what can people do to protect themselves from GBS? Are there ways to reduce the risk of getting it?
So this is an excellent question. We have a very high unawareness about certain things. Nowadays, it has become a norm, a rule rather, to order food from various platforms like Swiggy or Zomato, and oftentimes people who have registered as food vendors on these sites are nobody checks the cleanliness levels. So there are people, from street vendors to even the luxury hotels. You may look at the food rating and order, but you never know the cleanliness inside the kitchen, and especially the cloud kitchen where there's a lot of small spaces, food is stored for a longer time, and in a hurry to make food available quicker. So everybody has this competition now to deliver it quicker. Sometimes food is not even cooked well because of quicker delivery, and that's why half cooked meat is the number one risk factor for GBS. So please do not go for fast food or half cooked, half baked food. You very well know the famous pizza competition that you have to deliver in 30 minutes, and that's why the cooking time actually takes 1 minute. 1 or 2 minutes. How is the chicken going to be cooked in 1 or 2 minutes? So there are multiple factors. So when you order food, it should be ordered from a very well-known and clean and identified kitchen. Secondly, you should always make sure that out of the house, you should not uh, eat raw meat, or you should not eat raw milk, or you should not eat raw vegetables outside house. In the home, you can wash as much as you want, cook it well, and then eat it. But raw things outside home in hotels, or especially garnishings, जैसे even चाट लोग खाते हैं. So it has प्याज, tomato, kothmeer, and that has been touched by multiple people while cutting it, while cleaning it. So it is to be avoided at all costs. So eat fresh food, eat food that is well cooked. Avoid fast food, avoid ordering from outside, at least in this phase in Pune, and only eat clean, home cooked, well cooked food. Only use water which has been filtered well, or boiled water. These are the precautions one can take right now.
And so, what are the precautions people can take at home to prevent themselves? Like the food that the vegetables, the fruits, they that all come, they are also coming from outside. And yeah, sir.
Yeah, so one has to wash the food well. Fruits and vegetables have to be washed well. Secondly, the chicken, it should not be stored for a longer duration, and it should be used as early as possible. Any form of meat that is stored longer will carry this risk. Also, whenever it is cooked, please make sure that raw food, whether it is sushi or any other form of raw meat, or half cooked or undercooked, whether it is eggs or meat, one should avoid undercooked or raw food, especially meat, non-vegetarian food completely. It should be washed and cooked well.
Okay. So, and what role can policymakers and healthcare organizations play in ensuring better management and awareness of GBS?
I would strongly urge our health ministry and our government to please have a checkup with the cloud kitchens and stop the fast food delivery competition, which is actually resulting in undercooked food being delivered. So please make sure that the kitchens, cloud kitchens, are very clean. Of course, the water sources are being checked and they will be taken care of, but the cloud kitchens and the delivery systems, wherever the food is delivered from online platforms, they should have some gradation, they should have some cleanliness standards, and they should be assessed periodically.
That was really great, sir. And so, what final message would you like to leave with our audience today about the importance of GBS awareness?
I would say that we should not panic. This is compared to the population. This is still a lower number of cases. One should be aware. One should be very vigilant. But at the same time, there is no need to panic. Excellent neurological care consultants, hospitals are available in Pune, in Mumbai, in most of the district places. Good healthcare is available for treatment of GBS. Please do not ignore the symptoms. Please do not go by superstitions or herbal or some kind of unproven scientific modality to avoid hospital admission. If you feel weakness, if you think that you have symptoms related to GBS, please go and see a neurologist. And if admission is advised, please go for it. If when the doctors advise you ventilation or any form of treatment, please go for it. I'm also grateful that the government has made IVIG available freely, which also will help a lot of patients. So, not to panic, keep vigilant and avoid outside food. Eat only clean and well cooked food, is my message.
Thank you, sir, for taking the time to talk with us today and sharing your valuable insights on Guillain-Barré syndrome. Thank you very much. And so that this discussion has helped us understand why it is important to recognize the signs early, get timely treatment, and raise more awareness about this condition. Thank you all for joining us today once again, and a heartfelt thanks to Dr. Rajesh Deshpande for his time and expertise. Stay informed and stay healthy and take care.
Thank you, ma'am. Thank you for making me participate. Thank you.
Thank you, sir.